be even more ready to respond.
I'm sorry, 5 minutes goes fast. I yield back.
Thank the gentleman for yielding back, and now recognize Ms. Eshoo, the head of the ranking member of the Health Subcommittee. Ms. Eshoo, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Just a comment about the last exchange. In my view, something was left out of it. The American Rescue Plan. In March of 2021, the Congress passed, the President signed into law billions and billions of dollars for vaccines, for all of the things that would protect the American people. And that cannot be overlooked. It's an important discussion about schools and understanding how guidances work and who the agencies meet and talk to come up with the best policies going forward. It's all important in a hearing, but this cannot be overlooked. I don't know what would have happened to the people of our country without that rescue plan. And it wasn't unanimous, but it got done. Dr. Tabak, I'd like to ask you about, speaking of money, the Congress appropriated $1 billion to NIH to study long COVID. Patients have been waiting, and they've been more than patient, since December of 2019. I think the effort is called Recover, and it's to research, potential treatments. Where is that? How close are you to coming out with what's needed for those that have been waiting a long time?
We have put together a national cohort of patients at different stages of infection with COVID-19 and those who have already reported that they suffer from long COVID.
I'm familiar with that.
And
I want to know how close you are
well,
to
we're within the next few
the-
months to launch the first
mission.
interventional trials. The reason it has taken the time it has is because we wanted to build a large enough cohort of patients so that we would actually get actionable answers.
So it took from 2019 to now to get the cohorts?
Indeed, it has, because...
And how many are in it?
I'm sorry?
How many are participating in it?
I'd have to get back to you with specific numbers, but please appreciate that as the virus evolved, so too has long COVID.
Well, exactly. That's why I'm asking.
And that's why we need to continue to build a cohort that's representative of the disease so that the answers that we get with our interventional trials will have some actionable.
Okay. Well, if you have anything else that you can add to that, I'd appreciate learning it, getting it from you. To both the CDC and the FDA, I think the public and certainly members of Congress became all too familiar with advisory committees during, and that impacts your work. But I think that it also added to the confusion, the American people. Advisory is exactly that. It's advisory. And I have to say that I found it troubling. It seemed to me that there was a lack of balance between the ultimate decision maker and an advisory committee. An advisory committee. So can you, well, first of all, do you think that there should be some streamlining of these advisory committees and really make them more practical? Dr. Califf?
Thank you for that question. I actually chaired an FDA advisory committee for some period of time back in the good old days. I think advisory, it's like democracy, it's messy, and I think advisory committees are critical. The FDA full-time staff need to interact with outside experts in a structured manner, but you're right, they are advisory, they're not decision-making. Our regulatory decisions are made by full-time civil servants who don't have a conflict of interest financially and whose mission is preserving and protecting public health. We are looking across the FDA right now at what we can do. Streamline is one word. I would say to optimize the use of advisory committees. They're so important, whether it's food, tobacco, or rare diseases, for example. We need to have that kind of input. So it's critical. We need to make it better.
Dr. Walensky?
Yeah, I don't have much to add to that except to say that there is incredible value in the independent expert opinion of non-governmental officials who are very well recognized across the country in their field of vaccine that we have on our advisory committee on immunization practices. I agree they are messy. They have been challenging during this period of time.
Are you looking to change anything?
We are reviewing the advisory committee processes, yes. However, you know, I do think that there's an important component of our advisory committee on immunization practices that has been steadfast through all of vaccines. Certainly, it's been in the spotlight during COVID-19 vaccines, but there are many pediatric vaccines that have been reviewed carefully through this committee.
Gentlelady yields.